Okay, so this lesson is on the plasticity and functional recovery of the brain after trauma. This is page 40 to 41 of your textbook. So, brain plasticity. Well, plasticity is your brain's ability to change and adapt both functionally and physically. So, functionally is your cognition, so they're your thoughts and your ability to think and get your body to do things, and physically is how well you're able to move different parts of your body. And does this as a result of learning or new experiences. During infancy, your brain grows as much as 15,000 synaptic connections, which is twice as many in the adult brain. So the young brain can learn new things much more quickly than the adult brain. As we age, rarely used synapses are deleted and well-used ones are strengthened. This is what we know as synaptic pruning. So let's just have a quick look at this. If you have a look here, okay, at birth you don't have so many synapses. So these are synaptic connections. You can see these, they look like the axons that we talked about before. These grow rapidly, and at 6 years old, this is how a 6-year-old's synaptic connections are. You can see there's loads and loads and loads, and they're really, really dense. But over time, the ones that aren't used, and this is a 14-year-old's, okay, slowly disappear. Those connections slowly disappear. This is basically just being a little bit more sort of efficient in terms of the adult brain, because we don't necessarily need all of those connections, but they do diminish over time, and if you don't use them, you lose them. Okay, so let's have a look at research into plasticity. Maguire looked at London cab drivers. London cab drivers have to learn something called the knowledge. Okay, the knowledge is basically the map of London, being able to understand all the routes and diversions to get around London and get their clients to where they need to on time. So she found that the brains of these drivers had significantly more volume of grey matter in the posterior hippocampus, and the size of that hippocampus was bigger. So this is your control, and this is the brain of a London taxi cab driver. Can you see here? It is much larger, this gold size here, to this sort of yellow dot here. Okay, you can also see that the volume of grey matter was positively correlated with the amount of time spent learning and practicing to be a licensing driver. So the more practice they had, the bigger their posterior hippocampus actually was. Okay, so this again is evidence to show that the more learning you do, the stronger those connections are in your brain. So let's have a look at functional recovery. So the brain is actually really quite good at repairing itself if it's given the opportunity. After a brainstorm such as stroke, the brain can often adapt and compensate for damaged areas. So let's have a look at these images on your right hand side. This is a healthy brain. Okay, this is the brain lighting up when it is opening and closing a fist with its right hand. This is a person who's had a stroke, and you can see this part of their brain isn't, where they had the stroke, isn't working properly. And this is them also opening and closing their right hand. And you can see, all right, that the area which is that hand opening and closing is actually moved slightly to the right. Okay, so healthy areas of the brain has been able to take over the damaged area and help them to be able to move their hand again. Okay. So how does this actually work? So what happens during brain recovery? So sometimes another area of the brain will perform a task. This is what we call recruitment of homologous or similar areas of the brain to perform specific tasks. So here, if you have a look, this red section is damaged, shown in red, resulting in a particular loss of function. But over time, the opposite hemisphere will take over the job. Okay, it will learn that this side can't do it, so it takes over the job. There's also something called axonal sprouting. This is basically where, if you imagine these are your two axons going to do whatever the signal they need to pass on. On this side, this is the normal. However, some area of the brain gets damaged, and this axon is not able to get to its target anymore. What happens is over time, the axon near to it will take over the job, okay, and it will sprout a new axon to be able to get to that area of the brain that needs to be able to get the message. Also, obviously, you'll have new links with blood vessels to be able to support these neurons to do the same thing. So let's have a look at the evaluation. So what's so good about it? Well, knowing all about this is helping with neurorehabilitation. So this is basically learning ways to encourage the brain to build and create new neural pathways. So I'm sure you may have seen sort of people sort of trying to learn to walk again and being walked along sort of 2 bars, holding themselves up. So that's movement therapy. They also these days can use things like electrical stimulation to re-stimulate certain parts of the brain to help the brain to fix itself up to a certain point. Another bit of evaluation that actually sort of suggests that this is the case is something called negative plasticity. Sometimes this rewiring can go wrong, so it's basically evidence to know that because it goes wrong, we know that the brain rewires itself. 60 to 80% of amputees develop something called phantom limb syndrome. And this is thought to be due to cortical reorganisation in the somatosensory cortex. Now, if you have a look at this diagram here on the right, this here is your somatosensory cortex. Okay, and the somatosensory cortex responds to different parts of your body. Some of those are more sensitive than others. Now, if someone had their arm amputated, then this area of the somatosensory cortex would become not needed, not necessary. And with phantom limb syndrome, what actually happens is that other parts of the body start taking over the area of the brain that used to be linked to the arm. And so then the person starts feeling sensations as if the arm is there, when actually it's other parts of the body that are feeding back to that area of the brain. So they feel as if the arm's there, even though it might be actually someone touching their side of their face, okay, makes them feel like their arm is there. Interesting, really good research has helped people actually stop feeling phantom limb syndrome, which can cause people a lot of pain. So, age and plasticity. Unfortunately, the older you get, plasticity does tend to reduce with age. However, Bezzola has demonstrated how 40 hours of golf training actually produce changes in neural representations of movement in older participants. So it does show that neuroplasticity does continue over your lifespan. It just is a little bit harder. So if you have a look at this graph, okay, this is the effort required to make new connections. So it gets harder as you get older, okay, and this is the experience. So it's not that you can't do it, it just gets harder as you get older. Now, I really want you to think about this one. This is a bit of evidence called cognitive reserve. This suggests that a person's educational attainment and several other things, so social support, novel experiences, cognitive training, can actually influence how well the brain can function after injury. Schneider discovered that the more time brain patients had spent in education, the greater their chances of recovery. Little graph to the right also suggests that people with low cognitive reserve are also more likely to develop dementia earlier than people with, if you have a look at the green line, with high cognitive reserve. So actually, what does this tell you? Keep on learning. Keep going and go to education, go to university, and you hopefully won't get things like dementia. So your essay question will be, discuss research into the plasticity of the brain, including functional recovery. Thank you.